name is Sarah. I'm a nurse at TMC Obstetrics and also a 500-hour certified yoga instructor. Today, we're going to be talking about exercises that can relieve some of the symptoms of sciatica, which is really common in pregnancy and just due to the generalized inflammation that's happening in the body, the increased cardiovascular load that we have. So we have more volume in our body, exponentially more volume in our bloodstream in order to support that growing life. And so some of that lends itself to puffiness in the hands and the feet. And even if we don't notice it, we're looking at our hands, they look fine. We're noticing that in the nerves, in that carpal tunnel. So the carpal tunnel, literally a musculature, so a combination of muscles that go around the wrist, and they do surround some pretty big nerves that are sending messages to the brain from our hands. So if we type a lot, or we're using our hands a lot in other ways, oftentimes we're finding that we get some pretty significant pain in the wrists. So there are options for splinting. There are options for using KT tape. You can find information by asking your provider or one of the nurses at the office about those situations, but we're going to talk about how to relieve some of the stress on the carpal tunnel today. So let's just sit back in our chair. We can do this in a chair. You can do it standing if you want, but we're going to be working mostly with the shoulders and the arms here, trying to keep it really focused. So let's come into our breath just for a moment. So allowing the gaze to be gentle or the eyes to be closed, and always thinking about that string at the top of the head that's drawing the crown of the head toward the ceiling. That's going to give us a little bit better posture, which helps everything to function a little bit better in our bodies, our organ systems, as well as our muscle systems. And so just placing the hands on the lap, coming into the breath, just being aware of our normal breathing. So we don't need to apply any breathing practice here. Just becoming aware of the movement of the breath is going to help us to focus our intention for our practice today. And our minds are busy. That's totally normal. Just as the mind begins to wander, coming back to the movement of the breath. We're feeling that little bit of settling coming into our nervous system. And then let's just begin to scoot our backsides forward on the chair. I like to do most of my yoga movements with the backside almost to the edge of the chair, but I still feel really sturdy. I don't feel like I'm going to fall off either from the side or up and down. Thinking about our good structure in our hips and our thighs and our knees and down to our ankles. Feet are underneath the knees, so we're feeling really stable and supported. Let's float our hands out from the side body up overhead, already feeling those shoulders. And then let's press the walls away. When I say press, let's widen those fingers, really pressing as though we're trying to paint a really broad space on the walls out to the side body. We'll float the hands up again. Those palms turn skyward. And then when they're up overhead, they're toward each other. Let's press the walls away again. So we move with our breath. On the inhale, we're floating the hands up overhead. And on the exhale, we're pressing the walls away. We're going to inhale those hands up once again. Very nice. Let's sit really, really tall. I want you to think about lifting through the pinky. See how we just got a little taller? And then draw the arms down into the shoulders. So you're feeling like the shoulders are a little more steady. We're going to float the hands out in front of us like we're sleepwalking a little bit here. And then the right arm is going to cross over the body a little bit. Let's keep that arm long, no bend in the elbow. So it might not come super close. We also don't want to turn the body. We're keeping heart center radiating forward. We're going to bring the left arm up just so we're squeezing, or this right arm is like a 2x4, so there's no bend there, but this left arm is just giving a little bit of a squeeze. We feel a stretch in the deltoid muscle and in the upper back, in that trap muscle and up into the neck, but we're going to stay forward here. Take a couple of nice deep breaths. We're expanding the back body, and that helps to expand the stretch a little bit. And we'll release. And we raise those hands up overhead once again. I want you to take the fingers on that right hand and bring them down to the top of the neck or the top of the upper back here. Then the fingertips, so I'm going to cue this really slowly because people are like, left, right, where am I going? The fingertips on the left hand are going to come over to that elbow. This is not a possible range of motion for everyone's shoulders. So if this isn't working, you're like, I can't get to my elbow there, Sarah, I want you to bring your hand underneath to the tricep, the back of the upper arm, and you're just going to give a little press there. So this is really tight for a lot of people, and so we tend to hunch forward. So you're going to remember that the stability of your spine comes first. So it doesn't really matter where this arm is. We want to keep the stable structure of the spine, and then we just bring that other arm to give a little bit of stretch. So this stretch you're going to feel down through the tricep and then down into the armpit and the lat muscle. Big breaths. Remember, that's how we feel that expansion. Good. We'll float the hands up overhead. We'll bring them out in front of us once again. Let's bring the palms together and bring hands to heart center. We're going to press into that namaste movement here. We're pressing the palms together, but we don't want to let the hands separate. So keep the wrists together, the base of the hand together here. Remembering those shoulders are down and along the spine. We're lifted through the crown. And we might be able to press a little bit lower down toward the lat. Feel that stretch in the wrists. We'll release that a little bit. We bring the fingertips together and then the backs of the hands together. So same motion in reverse here, okay? And then we begin to just bring gently the elbows down toward the floor. We feel that stretch on the opposite side of the wrist, being really gentle. The wrists are delicate, so we're not forcing anything that feels painful. It should feel like a comfortable stretch. And we release. Let's bring the hands up overhead once again. Very nice. Wiggle those fingers a little bit. Get that circulation going. Very nice. And then we're going to bring the hands out in front of us once again. This time, the left arm like a 2x4 coming across the body. Shoulders stay exactly where they are, okay? So we're not trying to get over here. The arm's just coming across the body a little bit, and then the right arm bends at the elbow to give that stretch in the deltoid, the shoulder and the upper back. Very nice. A couple of deep breaths expands that stretch. And we release. Good. Hands come up overhead once again. This time, left hand comes down. So the palm of the hand is going to come down to the neck or the upper back. And the right hand comes over to apply a little pressure toward the back wall on the elbow. Remember, we are not symmetrical. So we're going to maybe come around to the front on this side and give a little gentle pressure on the tricep or the elbow from this direction. Just aiming to open up the bottom of the rotator cuff and the side body here. A couple of deep breaths. And we'll float the arms up overhead once again. Bring them down in front of us. Hands come to heart center. Let's interlace the fingers. Very nice. We're going to open up the palms toward the front of the room, toward me, and we're going to press the hands away. Really nice stretch through the hands and also through the wrists, the inside of that carpal tunnel. So just being aware, if there's pain here, I want you to back off, okay? We're not pressing into anything that's painful. It just should feel like nice, juicy stretches. Very nice. So we bring the hands back in. Little warm up for the hands. We're going to bring the hands out in front of us like we're diving into a pool. Separate them so that they are shoulder width apart. And then just like a high five with that right hand, we're bringing the left hand across and we're just stretching the fingers back toward the nose a little bit. Press through the palm so that we're still pressing out, but remember, gentle stretch, not a force. A couple of nice deep breaths here. Stretching out through the fingers. So if you move the hand up a little bit, you get a little bit more of a stretch through the muscles in the fingers. And release. And then we're coming just to the thumb. So let's draw just the thumb back toward the nose a little bit. A couple of deep breaths here. Beautiful. Release back into that sleepwalker motion. And this time on the left side, we're high-fiving in front of us. Then we bring the right hand across and we bring the fingers back toward the nose. So I've got the full palm of my right hand crossing over the full length of my fingers on that left hand, drawing them back toward the nose. And then as that starts to get a little more comfortable with the breath, I move my hand a little higher and get the stretch into the fingertips a little bit. Very nice. Couple of deep breaths here. And release, and we'll come into the thumb. So just a gentle stretch of the thumb, remembering to press the palm of the hand toward the front of the room, just drawing the thumb back toward your nose. Good. We'll release that stretch. Let's take some flicks in the fingers, some wrist rolls. Do what feels comfortable here. If you're like, man, I really like the flicks of those fingers, go ahead and do that. Maybe some bigger ones, some wrist rolls in both directions. Nice. We'll bring our hands to the lap. Nice deep breath. Remember, we're always coming back to the breath, allowing the gaze to be gentler, the eyes to be closed. Shoulders are up toward the spine and then down along the back, just resting there. We're feeling tall and statuesque as we close this very isolated practice today. Focusing once again on the breath, taking a couple of moments of gratitude. And we'll bring our hands to heart center. The light in me honors the light in you. I hope you have a wonderful day today, and we'll see each other again soon. Namaste.